Hello, Adam. I hear from you, Chao. How be you and your family?
We all be cool, oh. I hope you be fine too. I dey call ask some questions about coronavirus.
Sure. What things you want know?
I hear say corona medicine dey wait them to hide them.
Me sef I hear, but it no be true. Plenty research they go on to find corona medicine, but this usually they take time. Researchers too they try some of the old medicines, and some they show good promise. We for hope say the hard work will pay off soon.
So what about medicines where people they call immune boosters? Then they fit prevent or cure corona? How about if I take plenty vitamin C and D?
As with all infections, your immune system they help fight corona. You go fit take some food supplements support your immune system. But if you dey chop balanced diet, you dey get enough nutrients. No research they so say taking plenty supplements will protect you from corona. The medicines them they call immune boosters too. Nothing they show say them go protect you.
And what about vaccines?
Yeah, vaccines they help, wow. But that usually be to protect people them no yet get the disease. Plenty research they go on to find corona vaccine, but this usually they take time. People self-start talk say vaccines no good, but that no be true. It be sake of vaccines where some diseases like polio no they worry we again. You know what? The vaccine matter there. I go take my time explain them later.
Oh, okay. So how we go protect one body from corona?
The best way be say you for day house as much as possible. But if you for come out, you for wear mask then day at least 2 meters from other people. You for make sure say the mask they cover your mouth then nose all. You also for wash then sanitize your hands more times, then make you no touch your face. Take some bleach to sanitize your surfaces. If you feel say you get corona, you for quarantine yourself. You for rest plenty, chop well, then drink plenty fluids. But if you know they make better, then you for call the emergency numbers. If you get corona, it no they mean say you go die. More people they recover cry. Yeah. We all for follow these simple directions. So say we go protect we and other people from corona. And we no go overburden one of healthcare professionals than healthcare system.
Hey, Dr. Amina, that you shack rough.
Hey, Adam, Sean that thing. Which madam then the kiddies give me. More people they recover.
Oh, better, bang. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, yeah, virus. Echewa, we go lost. Wash your hand daily with running water and don't stop. Keep away from non-family meetings and do something, bro. Pray for your enemy, pray for your family, pray for your country, yeah. Don't forget to keep clean with hand sanitizer. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, yeah, virus. Echewa. We go lost. China, Japan, man down. Italy, UK, man down. United States locked down. What now? Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona. It be virus, mania, funny serious. Corona, yeah, virus. Echewa, we go lost. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus, mania, funny serious. Corona, yeah, virus. Echewa, we go lost.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa. Hello, everyone, and welcome to the health segment on Trend Africa TV. I am your host, Empress Mausi. I want to say good morning, good afternoon, good evening to everyone joining us right now, wherever you are. And we are, this is the health segment on Trend Africa TV, COVID-19, the way forward. As we all know, in 2019, an outbreak of a disease attacked the city of Wuhan in China, which is a population of over 11 million people. And that outbreak has spread all over the world and is ending lives and taking lives. But right now, we have to learn how to live with COVID-19. That is why Trend Africa, in collaboration with some professionals and the Ghana National Council, we constantly bring you this program every other Thursday to give you updates on COVID-19 and how to live with it and the way forward. Right now, I would like to appeal to all viewers to please share the feed, invite your friends and family, and we'll take you from there. If you haven't subscribed to our YouTube channel yet, please subscribe to the channel and click on the notification button so that you would be notified anytime we go live or upload a new video. We would also ask of you to follow us on Facebook and Instagram. Viewers, don't touch that dial, don't go anywhere. We'll be right back. Share the.
It no be one photo. Say we dey fight corona.
My guys, I want to discuss some 7 things where people they talk about corona plus you.
You put the worry. You don't know say corona really kill black people.
Make you no make anybody lie you. Corona no dey slag give anybody crap. True say it start for China, but right there, it catch everywhere where they fit kill anybody, especially people where they get some other sickness. For places like Yankee, corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people with shada do am, or it be 5G self where they cause them. But shine your eye, it no be anybody do am. Where 5G to no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse righty. It just be upgrade. People too they talk say if you get corona with chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure corona.
So what about Sobolo?
Me self, I dey like Sobolo, but him too no they do corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, corona dey feel worry them papa. People too they talk say if you cut onions put your room, corona no go come there. But corona no dey like mosquito, where go fit kill am plus coil.
then how we go feel protect on our body?
Corona dey spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If for they wash your hands, then use hand sanitizer more times. But I beg, make you no drink am. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say get corona, make you go chop for one corner, so say no go spread am. If you get plenty rest, then drink more fluids. But if you dey make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, we will make sure say we go protect we, our family, our friends, then everybody from corona. We all for play one part, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
But we for take responsibility and keep fighting.
Ghana Fest. The 32nd annual Ghana Fest is coming to you live this year in a virtual grand style on Saturday, July 25th at 3 p.m. Chicago time. Due to COVID-19, Ghana National Council will be bringing you a live virtual concert to celebrate the biggest summer showcase of rich Ghanaian music, fashion, food, and live performances. Yes, that's right. Streaming live from Ghana and Chicago, USA. We have an amazing lineup of events with live band performances, live gospel and hip-hop performances, a live cooking segment, fashion show, and many more. Your favorite Spain man, DJ Odikro, will be representing live from Chicago. Your host will be Giovanni Caleb and MC Nanaya K3 Mafo. Join the fun online via Facebook, Instagram, and YouTube on Saturday, July 25th at 3 p.m. Chicago time, as the Ghana National Council of Chicago and its affiliates brings you great entertainment. Let's get together virtually and vibe.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello, everyone, wherever you are. Good morning, good afternoon, good evening. I am your host, Empress Mousy, and I have the honor of being joined by our professional panels today. I'm honored to introduce to you Mrs. Eunice Cromwell, who is a family nurse practitioner and provides continuing comprehensive health care for all ages and genders while emphasizing on disease prevention. She's also the financial manager of the Ghana National Council. Mrs. Eunice cannot join us by video today. However, we're going to be hearing her sweet voice online. Eunice, are you there?
I'm here. Thank you. Good evening to all.
Yeah, thanks for joining. And then, secondly, I would like to welcome our own Dr. Edward Ofori, who is an assistant professor of the pharmaceutical sciences at the Chicago State College of Pharmacy. He is also a professional pharmacist and a researcher in mental health and neuropsychiatry. Hi, Dr. Ofori. Thanks for joining us.
Hi, everyone. I'm glad to be on here today. And
the last but not the least, we are also honored to be joined by a very smart woman. She is Dr. LEVETTE OWUSU Ansah. She is a pharmacist with 20 years of experience, wow, in retail and hospital settings. She is currently working as a clinical informatic pharmacist with Loretto Hospital. Dr. LEVETTE OWUSU, thanks for joining us.
Thank you for having me.
How would you like me to refer to you?
LEVETTE is fine.
Dr. LEVETTE, I have to put the respect there. I have to show some respect.
Actually, I prefer Ejewa, but you know,
Ejewa.
For posterity reasons, I'll just go with LEVETTE. LEVETTE is fine. You know, a lot of pharmacists, we don't really do ourselves justice with a doctor because
no, you have to.
People just call us whatever. Because if you work in like a retail setting, you're right next to the meat department, so. It's like it's kind of awkward when people are calling you doctor when you are selling meat on the side. So it's kind of we've never really embraced the doctor title.
Doctor title, right?
Yeah.
Well, over here we're going to embrace it because we want our viewers to know that you guys are professionals, and we're very grateful for donating your time to this good cause.
Yeah. Well, thank you. We also like to give back to our community.
Thank you.
This is one way we can do that.
Without much ado, viewers, I would like to give the platform to Mrs. Eunice Cromwell, our beautiful Mrs. Eunice Cromwell. She's going to give us an update on COVID-19 all over the USA and probably in Illinois. Eunice, over to you.
Thank you. You know, what I've noticed recently is that I heard on the internet that there's been a surge in cases. So what are we doing wrong? I think a lot of people are forgetting social distancing. They're forgetting to wear their mask, and they're thinking that this thing is over. So unfortunately, a lot of states are considering to roll back. Illinois in particular is considering to go from phase 4 back to phase 3. I also saw that the CPS school system and the Department of Education were deciding to not let kids go back to school in September because there's been so many cases. So I just really, really want to encourage us all that even though there was a decrease and we had somewhat flattened the curve, it's been tremendously increased because we are forgetting the things that we have already learned. So please let us continue to do social distancing. Let us also wear a mask. Make sure that you are wearing your surgical mask if you have one. If you have a cloth mask, Make sure that you are wearing it and then washing it with mild soap and water. You don't need to put it in the dryer so it will avoid any shrinking, but you can wash it maybe in the evening time, hang it over your shower curtain, let it dry properly, and then wear it. Also, remember when you are holding it inside your car, you don't need to wear a mask when you're inside your car, but you need to remove it and put it inside of a plastic bag so that when you're able to leave the car, you can put it back on. Make sure you are washing your hands for 20 seconds at a time. Hand sanitizer, very, very crucial. You're using hand sanitizer, but after you've used your hand sanitizer for about 3 or 4 times, make sure that you're getting to some soap and water to be able to wash your hands with antibacterial soap and water so you can wash all those bacteria away. Also, make sure that if you have a vitamin D deficiency, that you are taking your vitamin D supplements. There has been research that states that people who are taking vitamin D are less at risk or have a better immune system, I should say, than getting COVID-19. Also, make sure that we are taking care of our older people. Our older patients are still more at risk, and our younger patients are seen to be getting more COVID-19. So you make sure that your older patients who have comorbidities like hypertension, diabetes, chemotherapy, any immunosuppressive disease, people who are on oxygen, let us make sure that we are checking on these people and seeing that they have everything that they need. This is something that's going to be with us for a long time. We are working through it. There's a lot of new developments in there, but at the same time, we need to be patient and follow what the CDC recommendations are. So that's what I have for you today.
Mrs. Eunice, what phase are we in Illinois right now?
Currently, we were in phase 4. So we were at the point where we could do indoor dining. We could basically go anywhere as long as we had our face mask and we're staying 6 feet apart. But according to what I read today on the internet with the governor and mayor, they are considering dropping us back to stage 3. That's when there was no indoor dining. A lot of other places were closed because they have seen that there's been a significant increase in the COVID-19 viruses.
Thank you, Mrs. Eunice. Dr. Ofori, are you there?
Yes, I'm here, still struggling. Okay.
Oh, okay. Are you okay now?
Yeah, I'm good.
Anyway, you have a very beautiful haircut.
Oh, thank you.
So, Dr. Ofori, any updates in terms of treatment, or is there anything Mrs. Eunice missed out of her updates?
So one thing that I'll add is that I mean it's baffling how we are struggling to have our people or individuals wear the mask, because they've shown that if everybody wore a mask, we could cut down the infection rate to almost like 90%. That is tremendous amount of reduction in numbers within maybe a month or some few weeks. So I'm advocating that we try to keep on preaching the mask wearing. One analogy that I saw was very interesting is I think about it as a little kid that is peeing on you, right? So if you wore a mask, it's like the kid having a pants on, right? The chances of that kid peeing on you is very low, right? It traps the pee and you don't get exposed. So in a way, I think if we encourage people to wear the mask, we will not be rolling back from phase 4 to 3. Okay. Now, in the event that we don't have any treatment option, the only thing we do have now is preventative care, and which includes wearing masks, washing our hands, making sure that we stay out of crowd, and things that we've been doing that has moved us this far. So I still encourage everyone watching us to still keep on wearing what doing what we're supposed to do, wear the mask and keep on doing it. We are tired, I understand, but guess what? Like I keep saying, the virus is not. So you can see Florida, you can see Arizona, all these places that open very quick without being cautious are struggling at the point. Now, there are some interesting news coming up in terms of vaccines and drugs treatments. But the sad news is that even if you do find a vaccine today, it will take months before we get to some of us. I mean, maybe in the US, yeah, because I just found out that all the tablets of remdesivir, all the injections or the dosage forms of remdesivir in the United States have been bought by the United States government. What does that mean? It means that my grandmother in the village somewhere in Ghana will never see a remdesivir, right? So the best way to keep ourselves safe is to be more proactive and preventative in terms of how to avoid this infection. It is also evolving that, hey, maybe we might have a vaccine, but who knows? We're actually in the phase 2 for the most promising vaccine, which is going into phase 3 very soon. Again, when it goes to phase 3, that's not the end of it. It will take some months before we can actually have available vaccine for people. Now, by the projections that we're seeing now, by November 1st, they're expecting about 280,000 people die in the United States. I don't know how I can project that in Ghana, and I don't want to think about that. So I'm very dead serious about us, making sure that we enforce the preventative part of this pandemic. That is the only weapon we have, and we should not lose focus of that. There are people who are saying that they will not wear the mask. It reduces their oxygen levels. I'm yet to find out a publication that says that it cuts down your oxygen level, unless for little kids, right, where we tend to be more cautious. So I think that is all that I'll add for now, and I'll have my colleagues go on with it.
Okay, so Dr. Levette, we are going to be focusing on you right now. So because I know you don't have too much time to spend with us. I know you're tired. You just got off work, but you're sacrificing your time to spend some time with us. So thank you so much again, Dr. Levette. Dr. Levette, can you please introduce yourself to those joining us right now and what it is you do?
Thank you very much. I think you gave me a grand introduction. I'm a pharmacist. I'm a clinical pharmacist. I've been a pharmacist for 20 years. I started off working in the retail. I worked for OWUSU for about 10, and then I transferred to a hospital. I worked as a hospital pharmacist for another maybe 8.5 years, and after that I did some long-term care work, and I'm back in the hospital, but as in the world of informatics. It's an interesting field where we look at the EHR for short, which is the electronic health records, all the information that is being used.
Dr. Levette, we are only seeing half of your face.
I know, because my computer shut off, so I had to use my phone.
Oh,
so
okay.
Bear with me. Can you see me now?
Oh, this is better.
Okay.
Yes.
Okay, is it better? So just pretty much what I do right now is just using medication information, and making sure that its accuracy goes into the health system. So that's in a nutshell, just taking the culture of the hospital, taking every information and assessing and making sure that it's accurate before it goes into the systems.
All right. Thank you. As viewers, you can see she's very, very, very knowledgeable. So if you have any pharmaceutical questions for her, please go ahead and start typing in the comment section, and then we'll be answering accordingly. So Dr. Levette, can you let our viewers know what are some over-the-counter medications one should keep at home in this during this pandemic?
I would say vitamin C is a big one. We are seeing a lot of that in the hospitals there for people with COVID-19.
Okay.
We're seeing that the doctors are putting patients on vitamin C and zinc as well, in addition to the prescription medication. So I would say try to keep your supplements loaded, and vitamin D as well, because that also helps with the immune system.
And what are some non-pharmacological therapies that people can practice at home?
Exercise. always is good. You can never, do or miss out with exercise when it comes to your immune system. So I would say exercise. Try some form of like practicing yoga or some form of stretching. Those are things that I think and I believe will help us. Also, meditation. I'm not sure people's religious practices, but meditation also helps keeps that stress level down, because we've seen a lot of stories, scary stories with that tends to raise anxiety levels with COVID-19. The other day, I was reading that there was a child who died of COVID-19, not from symptoms, but from depression.
What?
Yes, he was, I think, if I'm not mistaken, maybe 12, 13-year-old child. So
Wow.
we really need to look at mental issues and how we can take care of ourselves mentally. That's one of the big deals.
So are you having to cater to a population where there's been a mental surge during this pandemic?
Yes, actually, at my hospital, we do see a lot of mental health patients, and most of them are admitted as with some kind of mental illness. But then we realize they do have or test positive for COVID, so they're moved back into our COVID units after we realize that they are exhibiting symptoms. But most of them come in with a diagnosis of some kind of mental anomaly before they are moved over to the COVID unit.
Yes. I'm also a nurse and I work on the floors, and then sometimes we have mental patients where they are positive for COVID, but they cannot comprehend that they need to be isolated. They cannot comprehend that they cannot move around, and it breaks my heart that sometimes you have to use self restraints to keep them contained in the room, because they cannot comprehend that, hey, you have to stay in the room. So
right.
Have you had to also dispense chemical restraints for those who are having mental issues whilst having COVID?
Oh, we do. I mean, it's you know what? Come to think about it, I'll say yes. I see a lot of Haldol and lorazepam even in those units. Yes, you do see those. Coming to think about it, I never really associated it with that, but yes, we've been seeing an increase of use of those medications in the COVID units.
Okay.
Yes.
Okay. Dr. For any question for her?
Yeah. So my question has to do with the impact. Hello.
Okay, go ahead, Dr. Ofori.
Go ahead.
All right. Yeah. So the quick question was, I wanted to see the impact that it has on like the mental health of people that don't show up in the clinic, right? So in the general population, what do you think this will have on them in terms of their mental health?
I think it's worsened it more so than anything, because of the confinement factor. We are all like confined, and our movements are restricted, so people aren't able to do what they really would be doing in their normal day-to-day practice. So this is a new normal, and it's an adjustment for others, and not everybody adjusts well to new lifestyles. It takes a while. So I think that there'll be a lot of use of therapy. It's really needed, even in the so-called normal population, because this is an adjustment that people are not really handling very well, believe it or not. Even going to day-to-day work, we have had to adjust. Sometimes you have to work from home. Sometimes you have to restrict yourself. All those things. For some who don't have the ability to cope, you do see them decline mentally.
Mm-hmm. And then a quick follow-up question. So I know you're a mother and you have kids at home. What is your take on how this pandemic has shaped how these kids feel?
For my kids personally, I think they're enjoying it, not going to school. That's honestly. But at the same time, I must say that I'm fortunate. They've handled it well, rather, I would say. I mean, I have kids who have different interests, and that helps. I have one who's very musically inclined, so he can play the music 24 hours a day. Maybe that's not normal, but that's his outlet. So I let him do that. And then you have the one who plays basketball 24 hours a day. So, you let him do that. And then I have one who's 18 and he wants to hang out. So every now and then I just make sure I'm like, do you have your mask? Make sure, you give him the necessary guidelines, because at the end of the day, they still don't understand the import of what's going on. So you really have to hone it down. The younger people don't get it. The younger kids, the young adults, between the ages of 18 they think they're invincible. But I'm like, you may be, but the problem is you have to think about the other people around you who are more susceptible to this disease. So that's what I try to explain to them. You may not get sick, but you also have to think about the people around you who may get sick, because COVID-19, I tell you, is not a joke. When it catches your lungs, you need every part of your lungs to fight the disease off, because it latches on so tight. And we're even seeing younger people, fatalities and dying from the disease as well. So we can't be fooled and say, no, I'm young and I can't get sick. So I explain all of this to them so that they understand that when you go out there, when you come back home, you have to clean up, because I'm older, so I don't want to be sick. And if I'm sick, I can't go to work, because I'm a healthcare worker. I need to be there. I'm not one that works from home as well. So it's a day by day process, we take it.
Dr. Fori, are you done with your questions? Oh, okay. Dr. LEVETTE, so I want to ask you, how can one get an emergency refill of medications in response to COVID-19, especially for elderly patients who have to pick up their medications? However, they also are high risk factors to contract the disease. So how are they getting their medication refills, and what options are there for people to patronize?
I think right now what they are doing in the retail setting, and if I may be wrong, but I haven't worked in retail in so long, but I think we are seeing a huge increase in filling like 90-day refills versus giving them short term.
Right.
Because most of these people have on these medications for chronic reasons. So I think there has been an override of giving just 30, but increasing the day supply for them. And with telemarketing being so prevalent now, because a lot of people or a lot of the outpatient care setting are doing stuff over video. So I think there's a lot of more call-ins and having them pick up over a long term. That's what I believe is going on now. So yes, you can pick up your medication. You shouldn't feel the need not to, because at the same time, too, I know that a lot of my colleagues who work out in the outpatient or retail setting are saying that they're not getting a lot of people coming in.
Right.
And I think that's the reason, because they're getting medications filled in bulk, so there's no need for them to keep coming, going back and forth. So that's what we are seeing.
So how are pharmacists reducing their risk? How are you minimizing your risk of exposure to COVID-19 with interaction to patients?
For most of those who have that patient interaction, which I would say would be retail, because many times in the hospital, other than maybe going for rounds, we don't really interact with the patients that much, and we have limited exposure to like the COVID-19 units. We're trying to, and this is just for the hospital setting, we do wear our mask, obviously before you go into the hospital, they do the temperature checks and the questions. So we get all of that before we get screened before we go in. And then in our work sites, we try to space ourselves as best as we can. It's not the perfect situation, but we try. I know that in the community, they've put up screens, just like they would do in the grocery store. So there's that minimized face-to-face interaction with your customers or your patients, I would call them. I know that they also are trying to do the 6 feet apart, this social distancing, and we are trying to wash our hands as much as possible, as much as we can. So we're still using the same safe practices and also trying to do a little bit to keep ourselves safe.
Thank you. So during this time of the pandemic, are you seeing a surge in people asking to be vaccinated? Is it safe to be vaccinated at this time?
I didn't hear you.
I'm sorry. So I'm asking, during this pandemic, are you seeing a surge in people wanting to be vaccinated? And is it safe to be vaccinated at this time?
That's a toss in the air as to vaccination. I think you see that there's a big school of thought that's against it, and then you see the people who are for it. But right now, like the vaccines are in the testing phase, so we really don't know what's going to be effective. So everything is like in the unknown. We are waiting to see that they will test it out and what the outcome of the testing will bring us. So I know a lot of people who are not for vaccines because there is the fear of the unknown. And then there are also those who also can't wait to get vaccinated because they want this for lack of a better word to go away. So right. It's for me, what I see both ends of the pendulum. So we are yet to see what happens.
Okay. Viewers, we are going to take a little break, and then Dr. Pori, I guess you have more questions for her, right?
Yeah, I do. Mm-hmm.
Okay, so we're going to take a little break and we'll be right back. Stay tuned.
Okay.
Wagwan, people of the world, I go by the name Mafia, aka Young Bass. And I'm representing right now for Trend Africa TV with your.
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images, or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
My guys, I want to discuss some 7 things where people they talk about Corona plus you.
You put the worry. You don't say Corona really kill black people.
Make you no make anybody lie you. Corona no dislike give anybody cry. True say it start for China, but right there, it catch everywhere where they feel kill anybody, especially people where they get some other sickness. For places like Yankee, Corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people with shada do am, or it be 5G self where they cause them. But shine your eye, it no be anybody do am. We 5G to no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse righty. It just be upgrade. People too they talk say if you get Corona with chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure Corona.
So what about Sobolo?
Me self, I dey like Sobolo, but into no they do Corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wait and they booze, Corona they feel worried them, papa. People too they talk say if you cut onions put your room, Corona no go come there. But Corona no they like mosquito, where go fit kill am plus coil.
Then how we go feel protect on our body?
Corona they spread where more people self get, where they no. So Charlie, if you no get anywhere important go, make you day house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink them. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces wey dey touch, but this no be for your body. Finally, if you feel say you get corona, make you go chop for one corner so say no go spread am. If you get plenty rest, then drink more fluids, but if you dey make worse, then for call the emergency numbers. Charlie, this be all for today, but if I hear any other thing, I will come back to talk about them. For now, we will make sure say we go protect we, our family, our friends, then everybody from corona. We all for play one part, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
But we for take responsibility and keep fighting.
Hi, my name is Ochiame Kwame the Rap Doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello everyone and welcome to the health segments on Trend Africa TV. I am your host, Empress Mousy. I am joined by Dr. Ofori, Dr. LEVETTE, also Ansa, and Miss Eunice Cromwell. Dr. Ofori, over to you.
Oh yes. So before we left, we were talking about vaccines and the fact that we might have, in the future, we don't even know. What do you think will be the dynamics when eventually we do have a vaccine? How do you think people are going to react to it in terms of whether they want to, have it or not and things like
that? That's a good question because I know for people of color, they are very skeptical. Mm-hmm. There's a big fear of the healthcare system amongst Black people, especially for what I know. So I'm not sure how well we are going to be able to sell vaccine to people in our neighborhoods. Then I work in a neighborhood that's 90% Black. They are underclass. They don't make so much money. So COVID-19 has hit that particular community really hard because of the access to healthcare. So having said that, I'm not sure how we will sell the idea of vaccine because I don't even know that the news media has done us any justice as to convincing us that the vaccine is the way to go. Although, having said that, we know that right now we are dependent on herd immunity, and with herd immunity, we really do depend on our vaccine. So I think there'll have to be a lot of education that will need to be done to get people to come out and convince people that the vaccine is the way to go. I mean, we've seen historically that vaccines have worked, and that we have benefited from the use of vaccines in other diseases that we've seen in the past. But with social media blowing out and with information being everywhere, it's going to be a little bit of a challenge. But I think with education and the proper processes put in place to convince people that is probably our way to go, because we've tried all these medications and we are not really seeing any tremendous benefit other than the decrease of the length of stay in the hospital. So what next will be the remedy? That's the question we need to be asking ourselves right now.
So still on the issue of vaccines, so what would you tell a layperson on the street that thinks that looks like, we, the medics, we are microwaving vaccines because we do tell them, hey, vaccines take years to make. We are making this fast vaccine for them. And also the second follow-up question is, what would you tell the Ghanaians or Africans that, still think they're going to try these vaccines on them, when eventually we do get one?
We've had a lot of, I don't want to say stories, but there have been issues with vaccines, to be honest with you. There have been information that has been concealed from people when giving them vaccines, and especially in our Black communities, we've seen that. I mean, if you go historically, if you go into looking into the Tuskegee Airmen and that history, so it really is skeptical. There has to be some kind of transparency if they want when it comes to healthcare and it comes to our society, our community. We need to know. People need to be educated as to what they're getting themselves into. People need to know what they're getting, and the truth needs to be told for people to be convinced. I mean, I'm not against medications. I that's my whole life, my livelihood anyway. So I can't sit here and say that medication is bad. No, there are times when you need. I mean, we always try to do the preventative measures, but there are times when you cannot avoid medication. Cannot avoid treatment modalities. So I'm not going to sit here and say that vaccines are all bad, but I also think that there has to be transparency and the truth needs to come out as to what they are giving people, because you can't tell people I'm treating you for some disease and then you're sterilizing them. That is just ethically and morally wrong. That's just one example. So that means you freeze a whole lot of people, because information is out there now. People are going to hear about it. So we need these drug companies and these people who are funding these drug companies to come out with the truth, because the bottom line is they want to make their own profits. But you can't do that at the expense of people, because you also have to look at the ethical issue that comes with it. So I hope that answers your question.
Yeah. So, yeah, I do have some reservation when it comes to vaccines, in the sense that right now a lot of places were trying what you mentioned earlier on about herd immunity, right? So there were some places that didn't shut down with it. They didn't state it, but as you can see, they're thinking, hey, like Florida and all these other places, let everybody get it, right? If we get 80% of the people get infected, we might have herd immunity. Now, I've been reading and investigating about the fact that some people that had mild symptoms of the infection are actually losing their antibodies over weeks, and that is a little bit concerning to me. That doesn't mean that even if I had it, is it a chance that I might be exposed and be able to come out with some symptoms down the line, or be able to transmit it. So these are all things that we need to put into perspective when it comes to looking at this pandemic. So I mean, we're all waiting on some kind of a save, because people are dying actually, thousands of people, and it's not looking good as we state now.
Yeah, I agree. And the thing is, the truth be told, we don't know. There's always we don't know. This is so new. This is it's all up in the air.
Yeah.
So, like you said, people were dependent on herd immunity, and that caused a lot of deaths because we did not realize the pathogenicity of this disease and the way it takes on people.
Yeah.
So, I mean, I think herd immunity ideally is usually the best, but then we are going to have to isolate people who are, who will be more prone to getting
The infection.
the infection and getting seriously ill, or who have increased risk of mortality and morbidity. You might want to separate that population, and then maybe leave it to the younger people who really don't, who think that they're invincible, and then maybe in that case, then they can, if we can get at least 75% of our population who are young and they are strong and they're getting the disease, then maybe, and this is just me, this is just my opinion, maybe then we can take the older people and the people who are more who have comorbidities. That is the only way we can see moving forward with herd immunity. But even younger people are dying from this disease.
Right.
I mean, and we need to take note of that, because the moment it catches your lungs, that's where the problem happens. We are trying to prevent it from getting into the lungs. So if it gets there, it's like you need everything to fight it, as you know. So ideally, herd immunity is probably the best, but how we're going to do it, it has to be well managed. That's what I want to say.
Yeah.
And looking at our history in this country, we really haven't managed COVID-19 properly at all. So there has to be processes and protocols that are put in place to get this achieved. And is it going to be easy? No, but can it be done? I think it can. But then we need discipline, we need protocols, we need everything that we can get to move forward and get our herd immunity, so that we can have it at a place where it's not killing everybody like it's doing right now.
Yeah. Okay. Yeah, I mean, I just think, herd immunity sounded very good in the beginning, but I mean, with our current situation, especially in the US, if you allow everything to go as it is, in order to achieve herd immunity, we're going to lose 5 million people. Think about it.
Yep.
So
I agree.
Yeah. So that is very alarming. I mean, we are currently running about 5% infection rate. Even if you cut down by half of that, and we allow almost 80% of the population to have an infection, we project about losing 5 million people.
Right. And remember, the R naught of the disease, we are forgetting that reproductive rate, one person is affecting 2 to 3 people. Now you take your whole household. Like me, I have 6 people in my, so if I come home, I'm infecting half of my
everybody.
family. So if we are a family of 6, so likelihood of infecting, so then that person goes somewhere else and they're infecting 2 to 3 people. So just look at how quickly the disease spreads. We have to understand how fast and how quickly it spreads. And that's what we are forgetting now that we are in phase 4. Everybody thinks everything is hunky-dory. No, this thing is still out there, and it's still infecting people at that rate. So we have to also understand that the reproductive rate of the disease is also very high. That's what makes it infectious.
Do you want a break? I can come in.
Go ahead. Yeah, mouse.
So, Dr. LEVETTE, I wanted to ask you, schools will be reopening during fall in America, and that is cause for concern for most of the parents, and putting into consideration what is happening in Ghana. Schools have reopened in Ghana, and we are seeing videos of students passing out and dying. And they're saying they contracted
COVID-19. Yeah,
so,
absolutely.
Do you have any news about what is going on in Ghana? in terms of schools reopening?
I'm sorry, could you ask again? I think you broke
What is
out for a
happening in
second
Ghana?
there.
Do you have any idea what is happening in Ghana?
I have a little bit. I was talking to family in Ghana, and I did hear that some of the students contracted COVID-19. So yes, there is a cause of concern, especially here with our kids going back to school. I believe that, especially with the college students, there's going to be a surge. I really do believe that, because they're going to be in close proximity with each other. You don't know where people are coming from, and the fact that they don't show or exhibit symptoms is a cause for concern. So that is something that needs to be addressed, how they're going to contain the students, how they're going to have them, their classes being held. Maybe they might have to do a lot of online classes as opposed to just physically meeting. I'm not sure how that's going to happen. I have two college students so far, and I have, two at home. So I am also very concerned how this is going to happen. I'm hearing that for my school, like for our school district, we're going to be doing less class, less students in the class, and then they're going to be having some classes done online. I know I don't want to do what I did last time, teaching my own kids and having the teachers being paid. That's because I'm not a teacher. I realize now I can't teach kids because I'll kill some kids. So they have to find a process where it's going to be effective to teach these kids. That's what they get paid for. That's what we pay taxes for them to teach our kids. So it's very frustrating when you have to work and teach. I know I can't do it. So, but yes, it's an issue that needs to be addressed, and they need to address it real quickly, because we are going. We only have 1 month, and the kids are going back to school. So I would like to see more teachers getting certified with online courses, and maybe moving forward, I want to see a lot more online classes being taught, and much better than what they did last year, because what they did, that was not online. Having us do the work was not online.
Well, I guess we weren't prepared. They had to come up with something real fast. So
some school districts did a better job. Mine was awful. Yes. They left everything to the parents, and that was just terrible, because you had to go fish for all the information. They didn't even give it to you. You had to go fish for it, and it was very, very frustrating. So imagine you have to teach 4 children. I was only teaching 1, and I was pulling my hair out.
Anyway, Mrs. Eunice Cromwell, are you there? She had some questions she wanted to ask.
I'm sorry. Yes, I'm here. Can you hear me?
Yes, we can hear you.
Okay, great. What I was going to ask actually was about the telehealth aspect. I know that with my own practice, telehealth has been really booming. And I know Dr. LEVETTE spoke about people in underprivileged communities who were having hard times like getting their medication. So they were giving them a 90-day supply. But have you seen in your own practice that more people who you were not servicing are getting service? I was telling Dr. Ofori a little while ago that for me, my patients have increased because the patients who were never doing like preventative medicine, now they're able to call them and tell them that, hey, your doctor is going to be calling you. We're able to call them and get them, a virtual visit so we can be able to monitor their hypertension and diabetes. So to me, I feel almost like this virus has done good in that aspect, because these people were never concerned about preventative medicine, right? And now you see on the television that, since Black people are more disproportionate in getting this virus, they're taking it more seriously. So have you seen that more in your practice, like when you're filling the medications? Patients that maybe you haven't seen for a long time are more active in getting their preventative medications?
Okay. Thank you. Thank you. Eunice, one thing is I really don't work in the community, but I'm going to say what I see, because we do have an outpatient pharmacy where I work. So I do see that I do see them fill a lot more prescriptions than even in this time of COVID, I think that the awareness for health overall has increased, even especially in the mental aspect, because my hospital, we do a lot of we see a lot of mental health patients. So I want to say that I have seen an increase in the awareness of taking care of yourself a little bit more better, and with the publicity that has been created with the whole healthcare disparity, I think that more is being done to bring better health to disadvantaged communities, which makes it you know, it's encouraging to see that, because over the years and my practice, it's been a challenge to try to get our own people to understand that we have to take better care of ourselves. So I think with this and with the publicity that we have seen, especially with Illinois, where we've had disproportionate people dying from COVID, I think we are beginning to see a lot more people being more aware of taking better care of their health. So I think that what we want to see it more is that the government has to open channels more for these people to have better health care. That's what I would like to see. Better health access to health care, and us not being afraid to go to the doctor for one reason or the other. Because I mean, with what has been going on, we have been enlightened to know that even in healthcare, there is systemic racism, and even how they treat people of color is even a little different from how they would treat your average white person. So all of these things culminate, and all of these things overall help to address healthcare issues in our communities, or in our communities that are disadvantaged.
You know what? I completely agree. What is also your take on the polypharmacy? When I used to work in the nursing home setting, a lot of elderly people had a lot of medications they were taking for a lot of different reasons. And now with COVID-19, everyone thinks that they're a pharmacist or a physician. Everyone is looking for different things to take in terms of supplements and other medications. So would you think that this virus has brought on more polypharmacy?
I think polypharmacy is a big problem in general in our society. Actually, I specialize in geriatric pharmacy. So when I'm going through a patient profile, the first thing I look at is their medications and why they're on one medication, because what you see is that they're being treated for one side effect or the other. So a patient takes one medication and they get a side effect of maybe, but I can't think of something right now, but then they're given another medication for that to treat that side effect, and then that causes another side effect, and they're given it. So we need to find ways to manage people's care better when it comes to medication management. You probably will see a lot of people who are taking a lot of supplements. I think we can scale that down, and I think that we could get better results from getting people taking lesser amount of pills rather than taking a whole slew of pills, because especially when you're dealing with your elderly population who don't have people who can support them, we really need to find better ways to manage their medications. There are medications that you can take one medication that can treat 3 different things. We need to start to look at it and address how we can fix those problems and those issues, and have people be more compliant with taking their medications, as opposed to, eventually they get frustrated. I just take 1-2 medications and I struggle. So I can't imagine being on 15 medications. How do you keep up with those things? So these are issues that need to be addressed. And in times of COVID, yes, I could see why with social media, all the rant and rave about medication, people are more likely to go out there and buy or just purchase medications just from based on what they hear and what they see, and not even ask for advice. I'm hearing right now, like in Ghana, for example, it's hard to find antibiotics because everybody's stashing antibiotics just to take it for prophylaxis. And this is where pharmacists can advise rather than sell it, because it looks like the pharmacists are selling it because they're making a profit, rather than advising people that you can't take these medications the way you are taking them. So education is key when it comes to medication. We really need to educate people on the importance and how the medication works. It's, one medication doesn't work like the other. And I think that's what people think. Like when you take one medication and it works this way, the next one works the same way. No, they all have different ways in which they work. They have different targets, and they work in your body. And depending on even your genetic makeup, it may work. One medication may work for you versus another. So these are all factors that we need to look at.
Right.
Yes, I really agree. And you know what, Dr. Levette, what I'll share with you, what I've noticed that has been increased since I've been working at home is the management of pain. A lot of my patients have arthritis, and now that they're more homebound and they're not able to really go anywhere, there's always the need to get more pain medication. And then a lot of my patients also have chronic kidney disease, right? Whether it's stage 1 or stage 3. So I'm trying my best to stay away from NSAIDs and other medication, but I have found myself really reaching out to the pain management specialist. Like, I don't know what else to do. I'll give somebody something like Tylenol, but then, some of these elderly people, when it's not working, 1 or 2 of them, they end up taking 3 or 4, and then you're worried about liver enzymes. So That's been my biggest dilemma, just managing the patient with pain. Whenever the weather changes a little bit, I get phone calls all day. Eunice, my joints are hurting, my hip hurts, my knee hurts. And it is very, very difficult to manage their pain at home.
It is.
Especially with COVID. It's been quite the struggle.
And we know pain management is a big issue in this country, because then you go into the area of misuse and abuse, whether it's just NSAID or whether it's narcotics. People tend to want to numb themselves from that pain. I'm sure you've dealt with non-pharmacological treatments they can use and try to help them scale down the use of NSAIDs, because at the end of the day, NSAIDs, they can affect your liver, they can affect your kidneys more so. I mean, I guess acetaminophen is what affects the liver more so. So it's a toss up. I'm not even sure how to address the issue of pain management anymore, because a lot of people in this country run to things that will help numb that pain. I think we need to learn to manage it non-pharmacologically. I am a believer of that. I don't necessarily think pain kills. I mean, pain just is a signal that there's something wrong somewhere. But at the same time, too, of course, you don't want to be in pain 24 hours a day. Of course, it's not comfortable. But if we can have other avenues that we can use to manage pain, rather than just taking or popping pills and exceeding our maximum daily allowance, because eventually what happens is that you get so desensitized to that medication you're taking, and then they will have to switch you to something else.
Right.
You have to switch you, and then what's next? Then you run out of medications to take. And then that's when people move into the area of misuse and abuse, and then you have to go through the whole rehab and all that stuff. So I'm not sure how to address the issue of pain other than let's try non-pharmacological treatments first.
Right.
Maybe we can try some healthy supplements like glucosamine and chondroitin. Maybe we can start from there, although we know that it takes a while to work. Maybe instead of waiting till the pain gets unbearable, maybe we need to start taking those or look into those supplements that will help us manage our pain better.
And insomnia is also a very big one too.
Exactly.
I've been giving a lot of my patients like the melatonin, and then they'll call me back and say, this doesn't work. And I'm like, well, you have to, give it a little bit of time to work. But everyone is so used to the Ambien and the Xanax
Exactly.
and theory, because
and lorazepam, yeah.
And lorazepam, yes.
Exactly. And when you're older, those things are just not good for you in the long term. And you look at the labs that are coming in and, it's affecting them right away. And whenever you try to explain this to them, because you're explaining to them through the phone, they just feel like, if we were in person, maybe I would have a different approach. But medicine is medicine, whether it's on the phone or the video person, you just have to do the right thing.
Exactly. It's a toss up with because I struggle with sleep myself personally, and I try to stay away from medication. I just try to stay away from medication because in the long run, it's like you get used to taking it, and I don't want to be one that will take medication with it, just because I can't sleep. I think I'll look for other avenues. Exercise, meditation, yoga. Let's try those things first and see if it works rather than just jump into taking medication.
Right. Okay, viewers. Dr. Ofori and Eunice, you don't have any questions for her anymore, do you?
No, thank you so much, Dr. LEVETTE.
Yeah. No, thank you.
So knowledgeable. We appreciate you a lot.
Thank you. Thank you.
Dr. LEVETTE, I know you just got off work. You're so tired. I know you're trying to keep your eyes open.
You can tell, right? I had my glass of wine. That's my Corona, de-stressor. So don't tell my pastor. I had to have my shot because.
So, Dr. LEVETTE, could you please let us take a break, and when you come back, you give us your last word, and then you can go and
Sure. Okay.
Okay. So
sure.
Viewers, stay tuned. Don't go anywhere. We'll be right back.
It's here for me, Chiamo, God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Bibiansa sign. Why? Mamunsru. Yep, rocks watch it. The watch in a jar, that's a specialist. Jar, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamunsru. Environmentally friendly. Stays hot. I got a plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamunsru. Wati. Rocks watchy. The original is there. In the second demo. Yep. Powder for so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fan World Cup. Yes, yeah, do be a pie, do.
Ghana Fest. The 32nd annual Ghana Fest is coming to you live this year in a virtual grand style on Saturday, July 25th at 3 p.m. Chicago time. Due to COVID-19, Ghana National Council will be bringing you a live virtual concert to celebrate the biggest summer showcase of rich Ghanaian music, fashion, food, and live performances. Yes, that's right. Streaming live from Ghana and Chicago, USA. We have an amazing lineup of events with live band performances, live gospel and hip-hop performances, a live cooking segment, fashion show, and many more. Your favorite Spain man, DJ Odikro, will be representing live from Chicago. Your hosts will be Giovanni Caleb and MC Nanaya Okechi Mafo. Join the fun online via Facebook, Instagram, and YouTube on Saturday, July 25th at 3 p.m. Chicago time, as the Ghana National Council of Chicago and its affiliates brings you great entertainment. Let's get together virtually and vibe.
What it do, my people? It's your boy Kingsley Ego B, aka King the Preacher, aka the Peacemaker, aka the joy of the people is my peace of mind. You are now watching Trend Africa. Don't touch that dial. If you won't touch her. Come on there. Keep watching Trend Africa. We are here. Africa has come to stay. Don't touch that dial. One love. Keep watching. Ratata.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello, everyone, and welcome to the Trend Africa TV Health segment. I am Empress Mousy. Hello to everyone. Right now, I would just go ahead and give the platform to Dr. LEVETTE so that she gives us her closing comments and would let her go and take care of herself. Dr. LEVETTE, can you please give us your closing remarks?
Thank you. What we will stress on in these times, in these difficult times, is just let's adhere to the safe practice measures that have been put in place with COVID-19. Social distancing, trying to stay 6 feet apart from people, trying to wear our face mask when we are around people, realizing that you protect the other person from what you may have. That's the essence of wearing the mask. It's not just protecting yourself, but more so protecting the other people. We cannot be selfish at these times because you may be a carrier and not have symptoms, but somebody else may be prone to having symptoms. We need to wash our hands at least 20 seconds. All those things help. It's amazing what soap can do. That's what I tell people. Soap is the most practical way of killing this virus, more so than using even hand sanitizer. What happens with soap is that it disintegrates the virus completely, as opposed to hand sanitizer, which may just inactivate it. So let's try to wash our hands as much as possible. When you I work in a hospital, so when I come home, I have to make sure I shower down before I go and take care of my other activities. So these are things we need to be aware of. Just these basic principles can help us achieve our goal for being healthy and staying healthy in these times. Now, if you feel you have the disease or you have symptoms, please call your doctor. See what they have to say. They will determine whether or not you have to go to the hospital or not. Don't shy away from virtual visits. I mean, now virtual reality is our new normal right now. So let's take advantage of technology and keep ourselves safe. If we supplement takers, I will not shy you or discourage you from doing that. It helps. Everything you can do to help you keep safe. If you take your if you're taking vitamins, keep taking it. If you exercise, keep exercising. Let us keep doing what we do. If we're ones that practice meditation, all those things, we need our mental health. If you're one that goes for therapy, please continue to do that, because with everything that has, the shift in our normal life or day-to-day activity does affect us, and we don't even realize it. The power of the subconscious is something that I actually address, and that I am not a psychotherapist or anything, but it's something I like to study human behavior and how these external forces, what we're going through with our social issues and with COVID. I say that there are two pandemics right now, especially for people of color. We're dealing with the health pandemic, and we're also dealing with social injustices. So all these things, sometimes, how much more can you take? I tell myself, you deal with it when you go to work as a woman of color who works in a profession that is not highly populated by Black people. You know, you get it from all kinds of angles. And then you're a mother, you have children, your wife, everybody's pulling you in different directions. So at the end of the day, you need to get your mental sanity, you need to get mental health. And I cannot stress that even more in these times. So I know that Ghanaians, we tend to be reluctant to go for therapy and all those things, but we have to start to have an open mind about these things. We need, if you need it, you need it. I understand we have Jesus, I understand we have our churches, I understand prayer, but we also sometimes need to get, if we need to get that mental health, we need to get it. If you need to take medication to keep you balanced, if you need it, you need it. We just get the right assessment and get the right channels to get you healthy. And that's what I have to say for right now.
Thank you so much for gracing our screens with your authentic African look. I love it. I love
Thank you. Thank you.
I know your husband is signaling you like, where's my food? Hello, where's my food?
No, I don't do that. He just got his own food, man.
Okay, Dr. LEVETTE, thank you so much. I hope the next time we call on you, you'll be willing to come.
I sure will. Thank you for having me. It's been a blast.
So much. Please.
Thank you.
Please have a wonderful evening. Okay.
All right. Thank you.
Goodbye.
Bye-bye.
Okay, Dr. Ofori, that was a wonderful young lady.
Yeah, that's wow. I would say my partner in crime. We do a lot of educative pieces. We represent Ghana Pharmacy Association in the Midwest. She's the president, I'm the vice president for the organization. Yeah. Wow. So yeah, we're here on the ticket of Ghana Pharmacists Association in the United States. We have a big umbrella that is have branches everywhere in the country. We do have people in Texas. We have people in Virginia, DC, and we also have a branch in Chicago and the Midwest. Yes.
You see, Dr. Ofori, you should be saying all these things. You know, I don't know why you guys are trying to be so humble. If I had all these titles, oh my God, oh my God, everybody will hear it every second.
Right.
We need to talk about all this because I mean you put in a lot of time and effort into upgrading yourselves and education. I mean, we need to give you that respect.
Sure.
You know, Dr. Ofori, have you heard about what is happening in Ghana? Did you see that video of that girl that died with her friends helping her, and the teachers were standing by? And I heard she passed away.
Yes.
Is it a boy or a girl? It's a boy.
Girl, right? I mean, I'm not too sure about the gender, but I mean, it's very alarming, and it's good that we're bringing it to light, right? So it all goes back to education. So from the little that I know about it, the incident is that people thought that she had COVID-19, and in Ghana, it's like a stigma, right? If you have COVID-19, it's a death sentence, pretty much. And it looks like we're going back to those days when HIV used to be like that, right? When people had a disease, they were shown in the community. People don't want to interact with them. That is what we're seeing in Ghana because we don't understand the disease. So it's pathetic that happened to the young lady. She probably had other illness, but then, you know, just the fact that we think people have COVID-19, that alone neglect, that doesn't make no sense, you know. So I think we should educate our people and let them know that having a disease is not a death sentence. I cannot hear you.
Can you hear me now?
Yeah, I can now. Mm-hmm.
I'm sorry. So I had a friend who just got really sick, and he was rushed to Kolebu, and he's better now and he's able to talk. And he told me because they thought he had COVID-19, they left him on a metal on a metal stretcher in Kolebu outside for a whole day, for 24
Oh
hours.
my goodness.
And because he couldn't talk, he couldn't breathe, they just left him there.
He could have died.
He could
right?
have died.
Yeah.
So he was telling me how Ghana just has this regard for human life. You know, they just don't. It's very pathetic. And I know you are coming up with a lot of this, this educative pieces where they are speaking pidgin to educate. Is it currently playing in Ghana?
Yeah, we do have a lot of outreach. We try to reach a lot of people in Ghana. We are building that platform so that we can educate our people through different platforms. I'm actually thinking about, having a podcast and, putting it out there. At the end of the day, it all comes down to how much information you know and the education piece of it. Think about it. This happened in Kolebu, right? And I'm pretty sure we have doctors and nurses that have been to school, right?
Yeah.
That are supposed to know better. But unfortunately, we do the worst things, right? And it really saddens my heart. One of my friends from Ghana came to the US and he said something that really stuck with me. He said, I love Ghana, but unfortunately, Ghana sometimes doesn't love me back, right? So he almost lost the wife because of neglect. And these are issues that we need to go deep down. We look at how we are testing a lot of people in Ghana. We are sending drones to deliver medication. But the bottom line is our healthcare delivery system has some cancers that we need to treat, right? It's all the way to the ground level. Someone was left there for a day. That should never happen, right? And because of that, it makes a lot of people worry when they get sick. Do you want to go to the hospital or not? Do you want to treat it at home? So before they go to the hospital, like you said, the person can't even talk. So it's not something that we should be proud of. We should work hard to improve our healthcare system in Ghana, and it starts now. We need to make sure that we provide the best for our people.
So, Dr. Ofori, I believe that as healthcare workers, and we are already making changes, no matter how minute it is. Here in Chicago, I believe one or two people are getting educated by this program that we always come up with every 2 weeks. Because sometimes I get people sending me messages, are you guys coming on or not? If we are running late, people are like, are you coming on? I'm waiting. So that is very encouraging to me to know that at least one or two people are waiting for the program to come on. But Dr. Ofori, I want to find out, is there a way we can collaborate with the Ministry of Health? Maybe we can collaborate and maybe start educating people in Ghana, because I feel like it's the lack of education, it's ignorance that is killing us.
Yes.
I feel like we have the resources, but we are so ignorant that we do not even know what we have. So I feel like if we can educate the people, how can we collaborate? How can we collaborate with the government of Ghana, or do we privatize our education? What do we do? How can we help?
So the collaboration starts right from here, and I think right now we do have a very good platform. Facebook, all these social media is doing great. We can use that to get to the lay person all the way in Ghana. The government, to some extent, is doing their part. The Ministry of Health in Ghana is doing their part to educate people. But I think the intensity of it is not really our focus. Ghana has a lot of issues to deal with to begin with.
Yes.
It's not just COVID. We actually have other pressing issues. So this has just come to compound it. And therefore, I believe that, we can do collaborative work in terms of how to help, educate our people through some of these collaborations. At the same time, I think we have to be intentional about what we're doing.
Right.
What does that mean? That we need to, preventative care. Over here, you can go to your doctor for a checkup, right? When I was in Ghana, that was never something that people were used to, that you would just go to the doctor just because you're not sick, but you just want to go have a checkup, you understand? But we need to start preaching that, because as you can see, a lot of people who are dying in the US are people with pre-existing conditions, right?
Right.
So imagine if we have the same issue in Ghana. I think we're going to have a lot of calamities, like a lot of casualties because of that. So we need to start looking at taking ownership of our own health, and being more proactive and eating very well, exercising, and things that actually improve our health. And therefore, we will have a better, healthy people in Ghana, so that we wouldn't have to worry about a lot of diseases killing us. The population in Ghana, there's not too many older, like the percentage of older population is very small as opposed to the US and other countries, because we don't live too long, and part of it is because we don't really take care of our health.
So, Dr. Ofori, with the educative materials that you keep coming up with, do you have any intentions of maybe translating them into languages that maybe could be shared in other countries, maybe other African countries, and maybe even in our own country? There are a lot of dialects where we can maybe translate into Ewe or Asante or Ashanti, so that those who don't understand it, because that's one of the problem I have every time the president gives a speech, because he's speaking in English, and I'm feeling like, half of the country don't even understand what you're saying.
Yeah.
And people are telling me, oh, you shouldn't say that English is our mother tongue. English is our, people just talk by heart.
Yeah.
So I'm like, can we like because what the concept you're coming up with is very, very intelligent. I can already tell you are a pace setter, you are a trailblazer. You understand?
Thank you.
Let me just give you, your
accolades. Thank you for that. Yeah.
Yeah. So Trend Africa is here. We're going to continue to collaborate with you.
Right.
And Miss Eunice Cromwell, such an influential person in the Ghanaian community here in Chicago. So I think with our baby steps we are taking, I think we're going to go far. Eunice, are you there?
I'm here. Thank you.
Yeah. What do you have to say?
I'm really I really like the topic that you guys are now discussing, and I do believe that translation to a common language is very, very important. The time that I spent in Ghana when I was working at the clinic setting, I had a translator that was helping me with patients translate everything into Fanti, and you'd be amazed how people can respond better to hearing things in their own language. And even when you talk about like dietary changes in terms of hypertension and diabetes, if you're talking to someone on the level that they can understand in terms of the food that they eat, here in America, we learn everything by the book, right? So if you're going to, use all this big English and tell people about saturated fats and all these other things, they're going to be like, what are you talking about? But if you have someone telling you that, when you eat your palm oil, you need to remove some of the oil from the soup, so it's very, very important. And I do think that with this platform and what Dr. Ofori is doing, it's wonderful. And if we can get those things translated and get it into the villages, you find a way to have an iPad or a television set where people can all join together for maybe like a town hall meeting, and this video can be shared in the language and people can ask questions. It will make a huge difference, because what is affecting Ghana right now to me is education.
Yes.
Education in terms of healthcare, because like Dr. Ofori said, and Dr. Awa even told us about maybe a month ago, the mortality rate in Ghana is so high, right? And people live to be around 60, 62, where we have patients here who are like 100. And there are a lot of people, believe it or not, in Ghana, in the villages, who live to be old too. But how can we get the whole nation to live a very fulfilling life? We have to continue to educate them and let them know that it is okay to go to your doctor every 6 months, but it's also a financial reason, right? Because if you don't have money, you can't go to the hospital. And so this goes back to the government and their insurance and what they cover and what they don't cover. So it's such a big problem. And it's something that I think of day and night. How do we encourage Ghanaians to go to the clinic or go for your preventative care when they can't afford it? If you're only making 100 Ghana cedis a month, you're not going to take 20 cedis of that to go to the doctor's office once a month when you have a family and other things. So it's a big social responsibility that the government really needs to evaluate and do something about.
Yep. And I 100% agree with all the sentiments you shared. We do have a system in Ghana, a health system in Ghana that is operating at a very barest minimum, right? I mean, we do have health insurance that for some reason it's not where it's supposed to be. Health is becoming more expensive every now and then, and people have other issues to attend to. So the same kind of issues we see in the US with our underprivileged communities, you have that multiplied by 100 times in Ghana, right? There were people walking down the streets with blood pressures that is like, really high, right? And they have no idea why they're having a headache. They will go to the pharmacy to buy Tylenol for that, but then they will just die like that, and then people will think, oh, this person was just living some few days ago. What happened to him, right? So these are things that, like she rightly said, we need to educate our people.
Yes.
Let's make sure that we are more intentional. The key word is that we need to be more intentional about it. We just don't do it just because COVID is here, right?
Right.
And then when COVID is gone, everybody goes back to running around and left and right. It just doesn't solve the problem. So the government, and then in tune with people, that some people are ready to volunteer actually to help with educating our people in Ghana. And yes, Health Info Africa is our platform. We are dedicated to translating some of these educating pieces into different languages. So I'll definitely, and I've already invited Mausi to it. I'll invite other people that can speak multiple languages. So very soon you're going to see other ones in different languages.
Nice one. So I guess we'll take a break now, and when we come back, we'll give our last comments or our closing comments, and then we'll bring the day to an end. So everyone stay tuned, don't go anywhere. We'll be right back.
Hi, my name is Ochiame Kwame, the rap dancer. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD, and they'll give you an amazing discount. Mobile doctors is my choice, and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile.
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images, or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
Ghana Fest. The 32nd annual Ghana Fest is coming to you live this year in a virtual grand style on Saturday, July 25th at 3 p.m. Chicago time. Due to COVID-19, Ghana National Council will be bringing you a live virtual concert to celebrate the biggest summer showcase of rich Ghanaian music, fashion, food, and live performances. Yes, that's right. Streaming live from Ghana and Chicago, USA. We have an amazing lineup of events with live band performances, live gospel and hip-hop performances, a live cooking segment, fashion show, and many more. Your favorite Spain man, DJ Odikro, will be representing live from Chicago. Your hosts will be Giovanni Caleb and MC Nanaya K. Mafo. Join the fun online via Facebook, Instagram, and YouTube on Saturday, Saturday, July 25th at 3 p.m. Chicago time as the Ghana National Council of Chicago and its affiliates brings you great entertainment. Let's get together virtually and vibe.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Everyone, if you're joining us right now, you are absolutely so late. The program is about to come to an end. This is the health segment on Trend Africa TV. Trend Africa is collaborating with some professionals where we are bringing you updates on COVID and the way forward, and also in collaboration with the Ghana National Council. So right now, I would give the platform to I guess Dr. Ofori is ready to give his closing remarks. Dr. Ofori, over to you.
All right. Yeah. So I'd like to thank everybody that tuned in to listen to our show. Again, the whole purpose of this is to educate the people and educate ourselves to empower everyone so that we can take care of our health. Because a healthy person, can do a lot, but then if you're unhealthy, you basically can't really enjoy life. So we advocate that we make sure that our people are healthy. So when it comes to COVID-19 and all the diseases that plague humanity, a lot of the time it all comes down to how you take care of yourself. As you can see, a lot of individuals that have been taking care of themselves, having their blood pressure, diabetes in check, tend to do better than people who don't. So what our advice is that let's stick with all the recommendations that our agencies, the CDC, the Ghana Health Services, and all these agencies have come up with, so that we can prevent this infection from claiming innocent lives. People that would have lived longer, now their lives have been cut short because of this virus. So let's stay safe, protect our people and our family, and make sure that we educate other people and spread this good news that we've shared today. So thank you very much for tuning in.
Thank you, Dr. Ofori. Have a good rest of the evening. We love you. Mrs. Eunice Cromwell, your closing remarks, please.
Thank you very much. I just like to thank the panel, thank this platform for everything that they're doing to make sure that we are bringing updated health information. It's very important. And I just want to remind us all that COVID-19 is something that is going to be with us for a while. So we must figure out a way to live through it. And we should be encouraged and continue to be motivated to just keep ourselves as healthy as possible. Make sure that any questions or concerns you have, please feel free to send it to the platform so we can be able to answer it for you. And that would also navigate us to know who to bring on next time for our panelists. So I wish everybody the very, very best. Keep yourself safe and healthy. Make sure you're wearing your mask and washing your hands. And have a wonderful rest of your evening. Thank you.
Thank you, the beautiful Mrs. Eunice Cromwell. As you can tell, she's not joining us by video, but her voice is equally cute. We love Mrs. Eunice Cromwell. She's also the financial manager for the Ghana National Council. Like I said before, very influential young lady in the community here in Chicago, and we love her so much. Viewers, thank you so much for joining us today. Again, we thank God for a beautiful Thursday. Guys, this is an opportunity for you to join with Trend Africa to make a change in every little way that we can, in our homes, in our communities, and eventually, you know, baby steps. Baby steps is, they said, little drops of water make a mighty ocean. You're gonna eventually make an impact. We just have to keep strong and continue to practice your safety measures. Wash your hands, the social distancing. You don't have to go out if you don't have to. Try and be responsible for your own life. You shouldn't just follow the herd or follow the crowd. You should always be responsible individually. I want to take this opportunity to thank our sponsors. Our sponsors are Omama TV, Holiday Africa TV, Powerhouse Media and Restaurants, Akese Skylines, Medus Designs, Odinuhu Designs, and the Ghana National Council. I want to thank all of them for sponsoring us. We also want to thank Trend Africa TV. The CEO is Royal Black Jesus. He's working feverishly behind the scenes to always make sure this program comes on every other Thursday. And we have other programs on other days too. So follow us so that you can know our program lineups, you know, subscribe to our YouTube channel. And then if you have a small business, or even if you have a big business you would like to advertise on our programs, please email us at trendafricatv@gmail.com, or you can also call us at 773-312-0318 or 773-756-6678. Also subscribe to our YouTube channel. If you are watching us on YouTube right now, hey, welcome, and I hope you enjoy the show. Right now, I would like to say good evening to all the viewers. You guys have a good night. Until next 2 weeks, goodbye.
Ghana Fest, Ghana Fest, Ghana Fest. The 32nd annual Ghana Fest is coming to you live this year in a virtual grand style on Saturday, July 25th at 3 p.m. Chicago time. Due to COVID-19, Ghana National Council will be bringing you a live virtual concert to celebrate the biggest summer showcase of rich Ghanaian music, fashion, food, and live performances. Yes, that's right. Streaming live from Ghana and Chicago, USA. We have an amazing lineup of events with live band performances, live gospel and hip-hop performances, a live cooking segment, fashion show, and many more. Your favorite Spain man, DJ Odikro, will be representing live from Chicago. Your host will be Giovanni Caleb and MC Nanaya Okechi Mafo. Join the fun online via Facebook, Instagram, and YouTube on Saturday, July 25th at 3 p.m. Chicago time, as the Ghana National Council of Chicago and its affiliates brings you great entertainment. Let's get together virtually and vibe.
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images, or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
It's here for me, Chiamo, God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Beyonce sign. Why? Mamunsru. Yep, rocks watch it. The watch in a jar, that's a specialist. Jar, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamunsru. Environmentally friendly. Stays hot. I got to plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamunsru. Rocks watch it. The original is there. Any demo. Yep. Powder for Fukuramudi, so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fan World Cup. Yes, yeah, do be a bit paiju.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.